Hello, I'm Dr. Khalid Yousuf, and I specialize in joint replacement here at Baylor Scott & White. I completed my medical school at the Louisiana State University, residency at University of Oklahoma, and my hip and knee replacement fellowship at the prestigious Mayo Clinic in Rochester, Minnesota. The goal of a hip replacement surgery is to remove the damaged aspects of the hip joint. These damaged aspects create stiffness, swelling, and pain. This process generally takes decades, but once it becomes painful, it is rapidly debilitating. Hip replacement surgery involves utilizing materials such as titanium and ceramic to reconstruct the hip joint, which will allow for improved range of motion and pain-free level of function. Advancements in technology have minimized the most feared complications of hip dislocation and leg length discrepancy. Unfortunately, these complications still do happen, but at a fraction compared to the old techniques. Patients always ask about anterior approach versus posterior approach hip replacement surgery. I almost exclusively will perform anterior approach replacement surgery. I was honored to be the 2019 Traveling Fellow by the Anterior Hip Foundation. I went around the country and operated with surgeons performing anterior hip replacements, and we shared and learned from each other. It is my belief that surgeons should minimize disrupting the patient's anatomy, and that the anterior approach helps me do hip replacement surgery without detaching any of the patient's muscles or tendons. The average joint replacement takes about 45 minutes to perform. Patients generally are walking hours after surgery and usually discharge home the same day. People who work from home are usually back to work around 7 to 10 days. They can drive around 3 weeks and return to most of their usual activities by 6 weeks. The goal of a knee replacement surgery is to remove the damaged aspects of the knee joint, which are creating stiffness, swelling, and pain. This includes the worn down cartilage and meniscus. Knee replacement is truly a misnomer, and the operation is more of a resurfacing procedure. We shave the cartilage out of the knee and cap the bones with metal implants. This is more similar to a crown that the dentist would give you. Another analogy is that we are retreading the tire, not replacing the tire. Knee replacement surgery involves using materials such as titanium and polyethylene plastic to reconstruct the knee joint. This allows for improved range of motion and pain-free function. Patients always ask about the different types of knee replacements out there. I perform robotic knee replacements, computer-navigated knee replacements, and even augmented reality knee replacements. In addition to these different types of technological advancements, there are also partial knee replacements and full knee replacements. In the right patient, a partial knee replacement can be an amazing solution. It is less invasive, it preserves the natural knee movements and kinematics. The key is picking the right patient. It is my philosophy that we should try to avoid surgery if at all possible. This means working on strengthening your body and getting healthier. In that process, patients will generally decrease inflammation, get stronger, and lose weight. Most often, this can help avoid surgery. Injections can be used if needed as well. If these options don't work and you're having trouble enjoying life, then I believe you should consider having a conversation with us about joint replacement surgery.